Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for a better business and a healthier life.
And I'm Fred Goldstein with Accountable Health, helping employers open during the COVID pandemic in a safe manner. So let's begin. We just had the July 4th holiday. I'm sure it's one of your favorites, Nick. And
Thanks for that. You think we celebrate that in the United Kingdom? That was a colossal loss for us. Happy July the 4th, everybody. Peace out.
I apologize for bringing that incident up, but we'll move forward onto, we just had this big holiday, obviously people going out, maybe people congregating a bit too much during the holidays. Some places were canceling fireworks, etc., trying to keep it safe. But we've had a lot of recent news now about face coverings and masks. Can you dive into that for us?
Yeah, so first of all, I hope everybody was wearing a mask, especially if the physical distancing was not in place, and, recognize that sometimes it's a challenge. But here's the thing, wearing a mask is extremely effective. But we had some really relevant information that was published last week that I think is important for people to understand. And I know everybody is trying, well, I would say most people are trying to do the best that they can with the data that we have. This is a moving target. This is the best available information today. And what we understand is that it turns out the bandanas, which I see a lot of people wearing, and all credit to them, they're playing their part. But it turns out they're not as good as a proper face covering. And by that, I mean a cloth face covering. So the things that you can get on Etsy, maybe they're available on other sites, but certainly for me in the peak of all of this, I had to go out. There were some fantastic people who pivoted, started producing these. All credit to them. I wish I could sew. I can only sew skin and people's bodies and things. I just can't do cotton. But, a cloth face covering, and, that's far more effective. In fact, bandanas appear to be, whilst they have some effect, it's really not good enough, especially when you're in close proximity. So you need to have a proper face covering, a cloth mask. And one of the things that I would describe here is preferably with multiple layers. That makes a big difference. Surgical masks, or what are essentially sort of professional health grade, absolutely better. There's some electrostatic principles that are applied that improve the performance. And in this study, no surprise here, the N95 mask was the top performer. That's not a reason to go out and get N95s. We still have a shortage problem, which is one of the reasons why the guidance early on was not about wearing masks. It was about the shortage. It wasn't that we didn't want people to wear it. We were worried that our healthcare providers wouldn't be able to access it. So use a proper cloth face covering, preferably with multiple layers, and make sure that it's wrapped around, covering the nose and the mouth. Essential to prevent the spread of this disease.
Great advice, makes a lot of sense. And I hope everybody follows through with that. And I hope as we see the numbers come out post July 4th, that everybody did follow through with that as well, as we walk around in the communities. So let's talk about another issue, which is this whole issue of testing and asymptomatics. And what are you seeing in that data?
So again, another great study. I think maybe it's at the beginning or the end of the month, we see a lot of publications, peer reviewed. And this particular study, there were a number of them, but one I want to focus on looked at the number of people testing positive to the virus that were asymptomatic. And by asymptomatic, we actually classify people in two categories: pre-symptomatic, which means you currently don't have the symptoms, and we know that they don't develop for typically 2 to 3 days, can be longer. And asymptomatic, never develop symptoms and essentially show test positive. What's interesting about that is as we start to test more, we're seeing an increased incidence of asymptomatics in the younger generation. So the younger you are, and let's pull out full-on pediatrics, so the very young, but young adults, we see a higher instance of positive tests for younger people. As you get older, it's less likely that you're going to be asymptomatic. That's important when we think about testing. So it's an additional data point. But I have a question for you, Fred. As we look at some of the data and certainly some of the reporting, we're getting all this conflicting information. You know, we're seeing decrease in numbers. You know, there's more people being tested, but we're seeing more negatives. What on earth is going on there?
Well, it's an interesting issue because what we're seeing, and it looks like, and even the CDC has confirmed this, and people need to understand this, most of the places are counting total tests versus positives, not total unique individuals. So let's give you an example. Let's say you had 10 people and one of them tests positive. So you're at a 10% infection rate, right? But if those 10 people got 15 tests in total, and you had 5 additionally, obviously your infection rate is now lower. And Florida has been pushing that number out for a long time now, and that was one of the reasons why the former data person for Florida was upset and is now publishing her own website, although she can't get the data on unique tests anymore either, on unique individuals. So the infection rates are being understated in many of these communities, and if we're using that number to make decisions, we need to understand what that number really is. And so as people look at these numbers, and whether it's the asymptomatics or the younger population getting infected, which is reducing the hospitalizations, a piece of this also has to do with how they're counting testing. And we also need to remember the hospitalizations are gonna lag behind the testing. You're gonna have a period where they're sick and not hospitalized. Some will then get hospitalized. Some will then get put into the ICU. They may be there for 30, 40 days, other people, before you finally have an outcome that's measured. So as people say, well, the rates are going up, but our hospitalizations aren't, while they are in Houston and clearly in Florida as well, that's something to consider, is that lag. Now, it clearly with the—
So let me ask, what is the lag? What's the typical lag? So how long do we need to wait past July the 4th or past any of these events where we see this aggregation to expect to see that?
So obviously that number is going to move around a little bit and there's variation in it, but you would probably consider something along 14 days because that's what you would want to quarantine an individual for. So you would assume within that amount of time, you might see somebody get hospitalized. But as you look at that number and then you start saying, well, the deaths aren't going up. Well, that's going to be post 14 days. That's going to be further out. And in some cases, we've seen people hospitalized 30, 40, maybe longer days before they ultimately are released, and thank gosh, or they expire. So there's certainly a lag here. We need to understand the lag. We're seeing numbers go up. I can tell you that in Florida, as I looked at it over the last few days, I saw ICU beds drop about 200. So we'll have to see where that ultimately gets to. But clearly Florida's going up, and we will see more hospitalizations, et cetera.
So I would say that, you know, add to the list or the bucket of things that you need to be an expert in as part of this whole experience is data analytics, multiple data sources, understanding the veracity of that data, and being able to tease out the signals in all of those different categories to provide insight. So, you know, fantastic to have you along. I love the fact that you have this sort of deep insight. So thanks for sharing some of that.
Well, it's my pleasure. And honestly, if you think about population health, this is a population health issue, is built on data. The underlying key is the data flowing through the system to help you make better decisions, to ultimately improve the health of populations, and to make things like reopening safer. So once again, Nick, some fantastic insights on masks and the asymptomatics as well. And looking forward to next week.
Fantastic. And I'm Dr. Nick. I'm the incrementalist here with incremental insights for better business and a better health.